Hello everyone, my name's Alexis, and today I'm going to be giving a presentation for a research class that I took this year at EKU while studying for my master's in occupational therapy. Throughout the class, we researched cancer-related fatigue management through a telehealth-based approach for treatment. The project was completed by Kelsey Drew, Corrine Feltner, Katie Green, Amanda Holland, Elizabeth Johnson, Emma Williams, Katherine White, myself, and Emily Thomson, along with our professor, Dr. Fleischer. We initially had 4 participants that started out in the study, but we only had 2 complete the 8-week intervention program. One participant partially completed the program and is hoping to restart the program in January of 2021. To address the client's needs throughout the pandemic, we adopted an online format of interacting with our participants. We had weekly Zoom video meetings for progress reports and goal structuring, and the participants were required to perform their own exercises and implement other occupational suggestions as identified by the physical and occupational therapy students. Each participant had access to a personalized Google site that had specific exercises demonstrated as recommended by a physical therapy student. On the Google site, we also recorded data and included graphics, links, and other visual aids that align with occupational goals set by occupational therapy students. The overall goal for each participant was to manage cancer-related fatigue while also analyzing and restructuring fatiguing and/or difficult occupations. The National Comprehensive Cancer Network defines cancer-related fatigue, or CRF, as a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with usual functioning. Some symptoms of CRF include physical fatigue, emotional stress, attention deficit, mental fatigue and exhaustion, physical pain, short-term memory loss, and nausea. These symptoms can heavily impact daily occupations like meal preparation, lawn maintenance, animal care, as well as other areas of well-being that include motivations, depression, anxiety, and social interactions. There are 6 factors that we tried to identify within the occupational patterns of our participants to indicate a need for intervention. They are poor coping with cancer and treatment of conditions, excessive fear of disease recurrence, dysfunctional cognitions regarding failure, dysregulation of sleep, dysregulation of activity, low social support, and negative social interactions. These factors were especially important to look for within our participants on top of other important areas because they were found to significantly impact fatigue levels in a condition-specific way. Interventions that have been found to be effective in reducing CRF include exercise and physical activity, psychoeducational interventions, and yoga. Exercise has been found to be the best studied intervention, and a regular exercise program can improve mood, fatigue, range of motion, strength, and quality of life. The greatest CRF reductions in the research studied came from interventions based on the theoretical model, and from interventions working with older cancer survivors, and ones that use moderate intensity resistive exercises. From these studies, the participants were reported to have improved vigor, better self-esteem, reduced anxiety, and less tension, among other benefits. To recruit participants, flyers were posted on social media and emailed to cancer care providers, cancer support groups, and individuals who have had cancer to advertise the study. Adults who have current or past medical diagnosis of cancer, have finished receiving treatment within the last 5 years, and are experiencing fatigue were eligible for the study. We had 2 participants complete the 8-week program. On the right side of the screen, here is where you can see a flyer that we posted on social media and sent to cancer support groups. Now I'm going to talk about how we specifically completed the study. First, schedules were created for each participant after gathering availability from the OTs and the PTs. Participants were scheduled for 8 consecutive weeks, consisting of an initial evaluation session, as well as 7 intervention sessions. During the initial evaluations, OT students reviewed the informed consent before administering the Canadian Occupational Performance Measure, or the COPM, to obtain information about the participant's occupational performance. After completion of the COPM, data analysis was performed to identify common themes within the assessment transcripts. After the initial evaluations, problem-solving sessions began for the participants along with an exercise routine given by the PTs to complete throughout the week. In addition to exercise, we used a client-centered interactive problem-solving approach to identify adaptations and/or techniques that could be applied to help them regain their ability to complete important occupations. Weekly one-hour sessions centered around how these adaptations and/or interventions were working together. Further modifications were made to help them meet their goals about what they found important and desirable to do. During the problem-solving sessions, OT students assisted participants in creating an action plan to address difficult occupations identified during the COPM. Each week, OT students checked in to determine whether the goals had been met and whether the action plans needed to be continued or discontinued. If the participants' goals were met, students worked to create new goals and action plans for the following week. Now we're going to be discussing the results of the study. We had 3 participants, as I mentioned, but only 2 completed the entire program. So, a little bit more about our participants. The women in our study were 54, 69, and 70. Participants either had had ovarian cancer or breast cancer that was diagnosed between 8 months and 2 years from the beginning of this program. The 2 participants that had completed the program were a retired teacher and a retired occupational therapist. To identify occupational themes in our participants' occupational lives, we analyzed the COPM transcripts through thematic analysis. Here are some of the themes found within the model of the CMOP-E. Her intervention consisted of her husband and her friends. Her environment consisted of her husband and her friends. Self-care occupations of laundry and cooking. Productive tasks were gardening and teaching. And for leisure, she liked to do yoga, watch TV, and read. Here are some of the quotes about her daily environment. When I'm really lucky, my husband will come up from the side of the computer and hand me a cup of coffee. There's plenty of people who would like to walk with me more, but I usually am just so tired. Sorry for the typos. Here are some quotes that indicate how self-care has been problematic for her. I think, oh my God, I'm more tired than I was when I went to bed every morning. So I put on some clothes and then I go downstairs and have coffee and breakfast, unless I'm so tired that I slept through my alarm. Here are some quotes that indicate her productive tasks. I don't have a very good work-life balance. I'm also the person in charge of our school garden. That's when my body feels the best, is when I can dig and haul and moving my body in the most way. Regarding leisure, the participant stated, and it's a yoga app, and it was amazing, and I did it every day, and it was even finding that my yoga workouts was increasing, and I was feeling better. I like to do the New York Times crossword puzzle online, and I read the New York Times and the Wall Street or the Washington Post every day. Here are some of the themes that we found within Participant 2's transcripts. For productive occupations, she noted housework and being a retired employee as an identity, and then exercise. For the physical context, she noted pain, arthritis, and lymphedema affecting her occupational performance. In the environmental context, she noted Zooms, social distancing, and a tri-level household as affecting her fatigue levels. In the self-care occupations, she mentioned continued cancer management and her morning routine. Categorized under affective, which is what has been affected in her life since noting the changes in her fatigue levels, she stated being annoyed with her pain and not being able to complete all of the same tasks she used to be able to complete. In the physical context, pain impacts her ability to complete valued occupations. This can be seen by her quote, I have been doing elliptical on a regular basis, and once I started getting pain in my right hip before. And that's been a couple months ago, so I haven't done very well with the elliptical. Physical limitations were also preventing socialization. She said, I was carrying the little chairs into the sanctuary. It's a picnic shelter. We've been sitting in the cars since I was kind of gimpy. She then talks about the pressure of cancer management on her self-care tasks by saying, with the cancer survivorship information, there's just a lot of emphasis on plant-based foods, so I try to put a lot of plants into our diets. And then I have a support group. Mommy Valley South has a support group, a cancer group that I do. Within her environmental and social context, she discussed the impacts of COVID in her home floor floor plan by saying, "So we haven't been doing a whole lot of outside activities. We've done a lot on Zoom. I have like a Bible study on Zoom on at noon, and there's some support groups on Zoom. I have a quilting group that I have I'm so sorry. I have a quilting group that we go to that I know that's well out of the house, but it's real social distance. I'm gonna have to carry it down from the upper. We have a tri-level, so I can carry it down from the steps into the laundry room, which is on the other side of the kitchen. Then I have to take it back up." I'm sorry I'm stumbling so much over the quotes. It's just they're written verbatim, so it's kind of hard to read someone else's dialect sometimes. Here are some of the themes that we found within Participant 4's transcripts. Within a leisure category, themes of horseback riding, camping, and hiking arose, as well as mentions of physical strength. She mentioned caring for her horses, cleaning their stalls, and doing house chores as important productive tasks. She also mentioned being dissatisfied with her current abilities. Some themes of leisure identified within her interview are found within these quotes. "It's the things I gave my life that gave my life enrichment that I'm having trouble with, except for reading, so those are the things I would like to work on." When she was asked about the importance of horseback riding, the participant stated, "That's my therapy. Anything else doesn't go right, but I can get on my horse and do a little ride, everything gets better. I cannot get on my horse safely without help." She also stated, "I'm having a hard time getting on and off my horse. I've lost more of what I would call brute strength. And it's a real struggle just to keep the strength that I have now, and I exercise every day to try and build the strength back up. I have to take breaks a little more often. I cannot lift the saddle up onto my horse's back, and I have a very lightweight saddle." Regarding productive tasks, the participant stated, "I can move the hay, but it's difficult. So other chores like vacuuming, dishes, laundry, that stuff really hasn't changed much. I guess not the regular day-to-day stuff that you have to do to keep your house clean and yourself clean. Those I can seem to do." It was clear that the participant was not happy with her current level of independent functioning from statements like, "It's pretty disgusting," made when commenting on her current abilities. And "It's very dissatisfied with my abilities right now, but determined to make them better." The data gathered from the COPM interview allows the therapist to determine important occupations lacking in performance and subjective satisfaction of performance from the participant's perspective, i.e., if an occupation is important to the participant, we determine how well the occupation is being performed and how satisfied the participant is with that performance to craft intervention plans tailored to the client's interests and goals. So here we can see that every 4 weeks, participant 2 was able to make gains in performance in all areas addressed for her in this program: laundry, exercise, and meal preparation by the 8-week reassessment, sorry. Participant 2 also made significant gains in satisfaction of performance for all goal areas, reaching 2 out of 3 occupational goals by week 4. Participant 4 had significant performance improvement at the 4-week assessment, but attributed her decrease in performance at week 8 to the increasing cold weather of the winter, as all her goal areas were outdoor tasks. Participant 4 worked on feeding her horses, riding her horses, transferring on and off her horse, camping, and hiking. Participant 4 had significant gains in satisfaction of performance at week 4 with similar data at week 8. Again, the drop was attributed to the changing weather. Now I'm going to give you a short overview of what happened during the weekly problem-solving sessions that were conducted with our participants and the OT students and the PT students. With participant 2, she was initially struggling to follow the exercise protocol from the PT for the study because she said that forming a new habit is difficult. She gets started too late in the day to get everything done, and she stays up too late at night sometimes and is tired in the morning due to her CRF. She worked with the OT to determine a plan to get sleep earlier without distractions. She set up reminders on a phone or laid out clothes the night before. They decided together that the best intervention would be using reminders on her phone to lay out clothes the night before, set at 11 p.m., and to start exercising in the morning at 8 a.m. with a reminder set on her phone to combat fatigue. At the 8-week reassessment, the client stated reminders on her cell phone to lay out clothes for morning exercise worked efficiently, and she will continue to implement this habit. And she has been completing meal prep and laundry tasks at the beginning of the week, spread across multiple days after suggested by the OT personnel on this study. Energy conservation techniques have a pattern of working for this client. With participant 4, she was initially struggling with mounting and dismounting her horse because getting her right leg over the saddle was difficult for her. She had tight muscles in her hips, decreased leg strength, and she got stiff after sitting for long periods of time. Some solutions determined by the therapist were activating hip muscles, increasing strength, stretching, walking prior to riding, and using a higher mounting block. As a plan, the client agreed to do hip activation exercises at least 4 times a week, which was motivated by a chance to mount and dismount independently on her horse. At the 8-week reassessment, the client successfully and regularly implemented the exercise protocol. It had been too cold to be riding her horse outside through November and December of 2020, so the client completed the exercises inside the home using the back of a couch to swing her leg and use the saddle. The client stated this program helped her gain a satisfactory level of performance, so she intends to continue implementing all suggestions. Overall, our participants were very satisfied with their personal results from the completion of the intervention program. They both reported improvements in their perceptions of their performance and satisfaction of completed occupations. Both participants also reported that completing this program left them with lasting suggestions and they will continue to implement in their daily life. They both reported they enjoyed the program and did not have anything more at the 8-week reassessment to ask the therapist for assistance with. This study is still ongoing, and we are still looking for participants in an 8-week online exercise and problem-solving session for cancer-related fatigue and occupational performance issues who meet our demographics. Here is a larger photo of the flyer for this study that we have previously shared on social media. I will also have it posted in the comment section of this video. If you are interested, please contact Dr. Ann Fleischer by her email provided, ann.fleischer@eku.edu. Thank you for your time, and I hope you enjoyed my presentation.